We are at the NMC Al-Nada Specialty Hospital, and we continue with the surgical insights. And today we're going to be speaking with Dr. Muthana, a urologist consultant. And I'm so grateful to have you here today. Doctor, how are you?
Fine. Nice to meet you.
Nice to meet you as well.
Yeah.
Doctor, urology is a little bit of sensitive, issue for some people to speak with. How do you make your patients comfortable so they can tell you about their problems?
Yeah, first, when we talk to the patient, most important in this, especially in urology, you have to be confidential. So all the information should be confidential. I should ask also the patient some direct question and let him to encourage him to tell me all his symptoms. Okay. So that will give the patient some
comfort.
He will be more comfortable. Even sometimes some patients, when they come, they feel embarrassed to talk in these things. So I'll ensure that nobody with us, only the patient and me. So at that time, he will talk more frankly and will explain his symptoms.
Perfect. And that way you get all the information you need from the patient. Okay. So now let's talk about patients, doctor, because obviously there's a lot of people out there who may not have the right information in order to come and see you. Mm-hmm. Let's talk about lifestyle in Dubai and how that can affect the, urology health of the person, right? We're talking about hot climates. We're talking about maybe some things like kidney stones that happen very common here. What are some of the lifestyle habits that we have here in the UAE that are impacting the...
Definitely, the high temperature and the humidity, and especially like workers that work in outdoor and they're exposed to high temperature, and then they will not compensate to that and will not take the measure to reduce impact. These things will reflected on the urinary system, and most common that will affect the formation of the stone. So when the urine become concentrated because a lot of water is lost from the patient, make urine concentrated, okay? And then this will predispose patient to formation of the stone. In addition, some food, especially increased salt in the food, this will also increase formation of the stone. So also a lot of junk food or the eating high protein. This also third factor. So we have less intake of water, more salt, more protein, especially red meat. Three factors will increase formation of the stone.
Of the kidney stones. What about urinary tract infections? Do you find that they're also very common here in the UAE?
Yes, especially in the female, because there is also the same water, but also something about taking the hygiene measure to reproduce, especially when using the public toilet. This will increase the possibility of not taking the good hygiene measures to eliminate. Also, working, some female come, especially working in the public or working outside, they will not prefer to go to some toilets and will keep staying a long time holding the urine. This is not good.
Not good.
And not drinking water, so that may increase the risk of the UTI.
Perfect. Okay, so a few tips to share with the public is for avoiding kidney stones is keep hydrating.
Keep hydrated, less intake of salt, less intake of red meat. And also, especially if the patient has recurrent formation of stone, should be periodic follow-up with the doctor to see, to detect the early stage of the stone and manage it.
Okay, so now let's get into it. How a person knows that their pain they're feeling is not just any common pain, but it's actually something related to kidney stones? Like, how do they know that kind of pain is a little bit different?
Yeah, the location and severity of the pain. Especially the pain of the kidney, it will be in the loin. So sometimes if the stone in the kidney may cause some discomfort, but if it's go and obstruct the way, the tract and the ureter, this will cause severe pain. So the patient will go immediately to emergency. But some cases less that patient may expect that it's back pain, is not related to the stone. So any pain in the loin especially and persist for a long time, not related to the movement, and there is maybe change in the habits of urination, more frequent urination, some burning sensation, this may give alarm that maybe this is a stone. This for mild cases, but for severe case that obstructive, immediately will get severe pain and you may go to the emergency.
Okay, perfect. Doctor, would you say that kidney stones are more common in men than in women, or is like about the same?
Little bit more in the men.
So now that we're talking about the kidney stones, that unfortunately seems that is something quite common here in the UAE.
Yeah.
Let's talk about the approach of how to do surgery about it and how to treat them. How do you approach the treatment for kidney stones? Like, what would be the first steps to take before we get into surgery?
After a diagnosis, and we know we call the burden of the stone. What's the size of the stone? What's the location of the stone? What's the damage that impact the urinary system? Then accordingly we will manage. Management, it ranges from conservative management, like some medicine that allow the stone to pass, some painkiller, some hydration, to immediate intervention. The intervention, if we choose this surgery, we have now, especially in the last 10 to 15 years, we have minimal invasive, and this is evolving every time. We have smaller scope, and that smaller and smaller scope, so we can reach to any stone now in the urinary system by a special we call day surgery. We do a morning, and then at night he will be at home. Okay. So this. Now any stone, we can go through this approach by flexible ureteroscope and go and apply laser, and we open the way and return in the same day it is at home. So this minimal invasive surgery, unless there is some large stone like 3-4 cm, this we can do also minimal invasive. Before we make large cut, now just a small pinhole 1 cm wound in the back, go by also scope, and we distract and take a stone if it is very large.
Okay.
Otherwise, if it is a 3 cm and below, we use the urinary tract in itself, opening. No need to any wound, no cut wound. Go by scope, no wound, distract, the way is open, patient at home at night, and we relieve the urinary system.
Amazing. So, doctor, at the same time now is minimal invasion, which is, I think, for the people who suffer from kidney stone, this is definitely life-changing.
Yeah.
How long is the recovery time after surgery?
Look, after we usually put a stent after taking the stent out. So as I told you, in the same day we will discharge the patient.
Okay.
The stent, it will stay about 10 days to 14 days. This may cause some mild discomfort, and we give some also medicine to reduce that discomfort.
Okay.
So after 2-3 days, he can resume his activities as go to the working or most of his activities. After 10 days, 3 minutes, we take the stent out under maybe sedation, just not deep anesthesia. Take the stent out, and he resume as usual.
Okay, perfect. And one last question about kidney stones. Is a person who had a kidney stones has higher chances to have recurring kidney stones, or once you get them out, usually the person won't get them again?
There is a patient, a patient get a stone. The percentage of the chance of getting a stone in the next 10 years, 50%.
Okay.
50% if he's not abide by the precaution that I informed and periodic follow-up.
Yeah.
Because also there is some patient has hereditary factor, play more factor more and getting more stone. There is some issue in the kidney. The kidney is like filter.
Yes.
Okay.
Correct.
So that in urine there is an ingredient form stone, and an ingredient prevent the stone. So this it will be in balance. So you now we don't have a stone because there is balance between these.
Okay.
If that balance disturbed, so more ingredient form stone, more, or the inhibitory less, the stone will fall. You get the point?
Yes.
So if there is any metabolic issue or hereditary factor increase this imbalance between ingredient that prevent and firm stone, the stone will fall.
The stone. Okay, good to know. Perfect. So
in addition, the other factors that we say lifestyle. So lifestyle, hereditary, will make the patient more susceptible for the stone.
For stone. So if you want to prevent the pain of a kidney stone, definitely lifestyle changes can definitely help.
Yeah.
Perfect. Okay, so now let's talk about men's health, right? And I would say something for men's health that is also maybe a little bit difficult for men to speak about is about prostate care and prostate cancer, okay? How would you approach a patient regarding who's suffering maybe some of the symptoms, but they don't know if they should come to a specialty like you? What would you suggest to the patients like that?
About, you mean which symptom related to the prostate or to the prostate?
Yes.
Any change in the habit of urination.
Okay.
Like difficult urination, interruption of urination frequency, urgency, some pain in the below the belt, we said in this area, or he noticed some blood. This is alarming sign. He should consult the urologist to address this issue, and we know what are the causes of this one.
Okay.
So by this change in habit of urination, you should consult the doctor the urologist to see what's the cause and manage accordingly.
Is there any advances regarding the treatment of prostate cancer or any kind of cancer when it comes to the urology health? Is there any advance in treatments for this kind of?
Yes. Look, prostate cancer in early stage, it will be confined to the prostate. And it is in early stage, no symptom.
Oh, okay.
No symptom. So if we detect this in this area, it will be curable. Many and also minimal invasive surgery is available here, even in UAE. So we recommend them in over 50 to do some tests, blood tests. Even if they don't have symptoms, we call PSA. We know if there is any probability or chance he has prostate cancer or no.
Okay,
so
good.
if we detect it in this early stage, even without symptom, it will be curable. But if he neglect himself and he got a lot of symptoms and come in advanced case, this will decrease the possibility of getting cure of this prostate cancer.
Okay, but that's amazing. There's definitely preventions and way to actually avoid it for it to happen.
So by use, I would recommend all men over 50 to come and make screening. I will check. Just simple blood test, 10 minutes, we'll take a blood and we know.
And it will save their life.
Yeah, especially if there is family history. A family history of prostate cancer, you should start from 45, not from 50.
From 50. Good to know. Okay, doctor. Now let's talk about something that it was a very specialty case of a young girl who went for a general gynecology test and they found a mass on it, right? And it turns out that there's something that you have to come into place in order to save this girl's life per se, or at least prolong her life. How the diagnostic of this situation happened? Tell us about this special patient.
Yes, it's 19 years old patient. She had some period or cycle issue. She went to the gynecologist. She did some ultrasound, and by ultrasound accidentally detected some mass, left renal mass. Then the gynecologist referred the case to me. I also took some screening ultrasound. Then to know the diagnosis, we did some tests we call CT scan with contrast. So unfortunately, the tumor, if any mass, took that contrast, and there is a special feature in the CT scan. So this suggests highly that it is renal cancer.
Okay.
The tumor was very large, and also this family they have some family history of the cancer in her uncle or also her aunt. So when they come to me, then I inform them there is some suspicion of the tumor and explain that how can we get rid of the tumor. Then any tumor, any case, we will discuss this with multidisciplinary team from urologist, oncologist, and radiologist. Then we took the final decision to remove or manage. So it is common practice. We have to, any case suspicion of malignancy, we have to go through this multidisciplinary team. We call tumor board. Then after that, we took the decision to remove the tumor. So also this done case with minimal invasive surgery, just 3 holes before also long wound.
Yeah.
Also three holes and this small wound. Then we took the kidney out and we saved the life, and now patient come for periodic follow-up and she is fine. Also minimal invasive surgery because the patient from second day I discharged the patient. Recovery, it will be fast, 3-4 days, she is okay.
And I think that's one thing that I'm going to say about the NNC hospital, that the multidisciplinary team is great. You guys all work together. So again, this girl just came from a gynecologist appointment and it turns out that her problem was a lot serious. So thank to you guys that work all together, she was able to, get the precise surgery diagnosed and get better.
Yeah, I'm building this also multidisciplinary team as a policy in the hospital, and also from me I'm making some groups with the doctor. So any referral, I inform him any case related to the urologist. So we here in NMC we are working like family, like team. So any case we can help to provide the best service to the patient.
Yeah, I love this about you guys. Okay, so now let's talk about innovation and technology regarding urology, right? Like you say, there's so many advances right now. Is there any specific advance in the system to treat any of the problems of urology here in the UAE that you say is definitely working well?
Yeah, look, the health system and all the equipment and the facilities is evolving and rapidly, especially in the last 10 years. And especially in the urology, as I told you, minimal invasive, the scope has become smaller. Also the robotic surgery, minimal invasive surgery, even the robot more advancement about just one small hole we go or the arm from it. So become more and more less invasive, and this will give a precise work and also help to fast recovery of the patient.
Amazing. Is there any specific, because you've been in the field for quite a while, right?
Yeah.
Is there any specific machine or procedure that now you're like, oh, I'm so glad this exists now? Is there any specific machine that you like?
Here we have as a minimal invasive laparoscopic and the flexible ureteroscope. This is the more common. And even for prostate, for benign enlargement, minimal invasive surgery, we have like Resium, Urolip. So all these new facility that make the treatment easier for the patient and with better result.
Okay, amazing. And just before we continue to lifestyle, I know there is a story that you are passionate about because, again, you can change lives, right? And sometimes people believe that when they have some kind of issues with, especially for men in prostate, they think that's it, right? They think that things are going to go down from now on. There's no hope for me. But you can tell us a different story.
Yeah.
So tell us about men's health and what it can be done when people think there's nothing to be done.
Yeah. One of the cases that I'm facing daily, so patient came 55 years old, male patient, and when he entered for some UTI simple things, then I start to ask him some question about his performance. So he's diabetic with history of poorly controlled diabetes and hypertension and some hyperlipidemia. So these three factors impact his performance.
Correct.
So he got low performance. So he said he saw that there is no hope. He used some medicine that worked at the beginning, then finals was not work. So he was sad about his performance and depressed. So when I asked him that some questionnaire, I took some information. Yeah, he has severe erectile dysfunction, low performance. Then I start to explain to him what are the solution that I have to manage his things. So one of that one, it is we have we call penile implant. This is malleable, and the hydraulic one. We have two option, especially the hydraulic one. So this he can get his performance to like one with 20 years. So when I explain, he's engineer working here as engineer, but he don't know that this option.
Exactly.
He don't know. He's not aware of what this is available. So when I informed him, he's very happy that he will return his performance. So yes, then we implant that one, and he'll tend to resume his performance, and we're very happy. So yeah, we have many options to give the confidence and resume his performance.
Yeah, and I'm just going to use that to tell doctor that doctors like you are the ones who dare to help people, right?
Yes.
Even if you think there's nothing to be done, they don't know. You guys have the knowledge, the technology.
Let them come, and we have a lot of
Exactly. Let them come and you'll be able to help them. Okay, just before we leave or before we go into the fire questions, is there any daily habit or lifestyle habit that you would recommend to people in order to take care of the kidneys and the whole system?
Whole urinary system. Just we said, first, exercise. We need exercise about 20 minutes, 2 to 3 times per week. Moderate exercise. Take good time for sleeping. This for sleep is important. Less stress, because if you go to sleep, you will improve level of testosterone. Exercise, good time for sleeping. This will improve your production of testosterone. This is important. And also the other things, more hydration, less intake of salt, less intake of red meat, periodic follow-up for urologists if there is a history of stone or all of these. Any alarming symptom you have, like especially blood in urine, change in the habit of urination, you have to consult the doctor. He will do the bill.
Amazing. Perfect, doctor. A lot of things that we learned with you today.
Thank
Now
you.
we're going to learn more about you, and we're going to do this with the fire questions, okay? So I'm going to fire the questions, and you're going to reply what the first thing comes to your mind. Are you ready?
Ready.
Okay. One urological tool you cannot live without.
Flexible ureteroscope.
Okay. I think this is the next one as well. Favorite minimal invasive technique or instrument?
So that flexible, the other one maybe ultrasound, both of them, please. My instrument in the clinic.
Amazing. Okay, coffee. Is it a friend or not so good for kidney health?
Accordingly, if the patient has some irritation of the bladder, frequency, urgency, we are encouraged to keep less intake of coffee.
Okay, perfect. Most common myth about urology that you don't want people to keep believing.
No solution for advanced case, everything we have.
Amazing. The most unexpected thing you have retrieved from a urinary tract.
Some foreign body or like
Yeah,
this.
the foreign body. Has anything like that come to you?
Yeah, some cases happened.
What is the most strange thing that you've seen there?
Leave it, skip.
Okay, quick tip for patients worry about recovery after urological surgery.
Yeah, with more advanced surgery, less and minimal invasive surgery, the recovery is changed from the past. Now it's fast.
Okay, perfect. One superfood for urinary tract infections.
We can say cranberry and pumpkin.
That's correct, right? I believe in that. Okay. Are you a morning person or a night owl?
Working any time there is work, I'm working.
You're 24/7, doctor. Okay. Give me a non-medical hobby that helps you unwind, that helps you relax.
Good sleep,
Perfect.
less stress.
Yes, good. If you weren't a urologist, which other specialty would you choose?
Urologist.
Okay, one word to describe the future of urology.
It's evolving and a lot of the improvement and technology are coming and evolving, and this will make the surgery less invasive.
Perfect. In a scale 1 to 10, how important is hydration for kidney health?
10.5.
10.5. Perfect. One lifestyle tip to reduce urinary symptoms at home. One lifestyle tip, I guess urinary infections, maybe? One tip to reduce the infections at home.
Yeah, proper take hygiene.
Okay.
Is taking hygiene, not to stay long time holding the urine, but hydration.
Perfect. And then the latest urology technology that you're most excited about.
Robotic surgery.
Okay, very good. Perfect. Doctor, it's amazing. We learned a lot from you. Thank you so much. And again, to the patients out there, there's great specialty doctors like you who are ready to listen and help them out. Perfect. Thank you, doctor.